I'm talking to Dr. Caroline Christie, who is a board member at Pegasus and for BPAC, and we're talking about self-care. So Caroline, welcome. It's great to have a chat to you, and self-care is dear to my heart. So tell us what you've been doing in the last little while. Yeah.
So we've been researching the evidence on what can put doctors under stress in their day-to-day work, and we found a number of factors relating to prescribing habits and also incidences and complaints.
Yeah.
And from that work we've then developed the pastoral care program to help doctors before they get to a major incident happening, so able to wrap support around them in an individualised way. And also use our data so that we can highlight areas of concern and provide more help that way.
Oh, cool. And with the pastoral care program, has that been running for a while or is it new?
So it's been running now for 10 years, and
Wow.
we've had nearly over 40 doctors now through the program.
Yeah.
And it's running very successfully, and we've got good data to show that when intervention does happen, we can improve performance and support the GP where needed and get them safely practicing, or if that's not possible, then look at a dignified retirement.
Yeah. Okay. So the evidence has come from where that you've been looking at? Is it from the sessions that the GPs have had with their pastoral care, or is it the data that you were looking at to start with?
Both. We
Yeah.
looked at data internationally, and there was a lot of data come out of Australia where they looked retrospectively and they found 10 years prior to a major incident the prescribing habits of that doctor had gone awry.
Oh wow. Yeah.
And so we've also in Pegasus also got 10 years of data on all our GPs, so we can do similar sort of analysis.
Mm-hmm. So do you go and visit someone whose prescribing's just going off beam slightly?
At the moment we are mainly reactive, but we would like to get to a proactive situation where we can monitor ahead of time and tap people on the shoulder when needed.
I don't know how I'd feel if someone came and tapped on my shoulder and said, "Oh, you're going a little bit stray here." Do you have good response from the people who are involved, the people who
Generally, yes. It's like, thank goodness you've called. I was struggling.
Oh wow.
Or wow, I need a holiday.
Yeah.
Or I need to cut back. So it's an eye opener for most people. Yeah.
Yeah. And so when you talk about self-care, what other things do you suggest to put in place for them to support them?
Well, coming from Canterbury, we know all about resilience.
Yeah.
So we talk about topping your bucket up. So if it's just constantly drained by the patients or by personal stress, we talk about how you're going to top that bucket back up. So whether it's sport or art or culture or whatever it is that you like to do in your personal time, just to get that work-life balance back.
Yeah. And I think we say it a lot to patients, but we probably don't say it to ourselves.
Yes. Yeah. So we have to look after ourselves before we can look after patients properly.
Yeah. Well, it sounds like it's going really well, and we'll get some more evidence down the track. Do you think?
Yes. Yeah. So we'll do. So we did one survey of GPs, doctors, and GPs, nurses, and pharmacists in Canterbury 2 years ago, and we'll run another survey shortly on where things are at with their self-care.
Marvellous. Well, thanks very much for talking to us today. I hope it goes well.
Yep.
And that your GPs in Canterbury are much better looked after than they have been. Thanks very much.